And now I'm going to bring a totally different experience, which is from the other side. And I'm going to ask a doctor to come and present his experience. And this is Dr. Abdul Ali, who is a trainee doctor. Well, he's a doctor, but he's training for specialization. And he's going to present to all of us his experience of dealing with dementia. Dr. Ali.
Good afternoon, guys. Well, I'm not really going to talk about my experience as such about dementia, but how we really assess dementia patients, because in the practice there's about 7 or 8 GPs, and all the dementia reviews get passed on to me, and I pretty much do all of them. And in a dementia review, I don't make a diagnosis, I don't treat, I don't look at the whole, I just look at the whole dementia picture and review what the condition is like, how it's moving, how it's evolving, and like we've heard from all the different experiences, it does move and it does evolve. It's not just the one diagnosis, and it's not something that's a spot diagnosis that you do and then you just leave it for however long you leave it for. It takes a bit of follow-up. And just before we start going through what we do for a review, I'll just talk about a bit of what dementia really, how it applies to the review that I do. So it's a syndrome, which is just a mixed bag of signs and symptoms that is associated with a decline in mental function and abilities beyond what's expected from the normal aging process. So it affects cognitive functions, which is just higher brain functions like memory, thinking, language, understanding and judgment. And it also has emotional issues from some of the stories we've heard, which is like difficulty in controlling emotions, changes in personality, and inappropriate behavior in social situations. So the review I do is performed every year, and it's very important that it's easily reproducible so that you can do it over a set period of time. So every year it's the same review that you do, so it doesn't skew the results, and it's also reproducible in location, as in other GP practices and other places can do the same kind of review that we do here. We can compare results. So it's based on the functions that I talked about in the previous slide, and it's very helpful to do it in presence of someone who knows the patient very well. So in the case of someone who's living at home, a family member, or in the case of a care home, someone who's directly involved in the care of the patient, because there's a lot of questions that the patient won't be able to answer themselves. So it includes these 4. This is what we do here, and it's the mini mental state exam, the 6-item cognitive impairment test, the dementia questionnaire that was devised here in Ashton, and the EMIS dementia template, which we'll go through very quickly. So that's the mini mental state exam. A lot of you guys have already seen this. I mean, the health professionals. It's a exam it's a point-based system based on 30, and it looks at 5 or 6 big major high state functions such as orientation, registration, everything's on there, attention, calculation, recall, language. It's very easy to do, and it does give a good indication of a decline in function, higher mental function. The 6-item cognitive impairment test is kind of an abbreviation of the previous test, has some extra things in it. Same, very good test for dementia. Well, that's in my experience. I don't have much experience. I've only just started. And this is the dementia questionnaire. So this is more to do with the general health and general care of the patient, as in the physical health, mobility, how they're sleeping, how they're eating, how they're caring for themselves. There's a bit more of a social aspect to the whole dementia issue, their hearing and vision and stuff like that, and how they cope with just normal daily activities. And also we look at the weight and some blood pressure and smoking status. All of that will be inputted in the EMIS template. EMIS is the system that we use in the GP practice here, and that template just puts all of what we've done in the 3 previous slides, the mini-mental state exam, the cognitive test, and the dementia questionnaire, just gets inputted in here, and it just gives you a good idea of, there's 4 pages I think to this, a good idea of how everything's progressing and whether anything needs to be done. It has dates and stuff like that in there, so that it just can be looked at. And I think that's about it.
Thanks very much indeed.